everyone, this is Dr. Ananya. Welcome to my channel. In today's video, we'll be talking about symptoms of OCD. Before beginning this video, I'd like you to subscribe to my channel so that I can share all the valuable and useful information with you. First of all, let us quickly understand what is OCD. OCD stands for Obsessive Compulsive Disorder. It is a chronic medical condition that involves obsession and compulsion. It features a pattern of unwanted thoughts and fear, also called as obsession. And this can lead to repetitive behavior that is called as compulsion. These obsessions and compulsions interfere with your daily activities and cause a lot of stress. People living with OCD typically experience obsessions in the first hand. And this obsession or unwanted urge can lead to a typical behavior of compulsion, that is, repeated actions. So, in a way, you can say compulsion can relieve the obsession or the obsessive thought. Some people may have a habit of checking the door twice. They need to check if the door is locked or not. Also, they have a habit of checking on the stove. They can do it 2 times or 3 times, but this does not significantly mean that the person is having OCD. Doing such acts for a normal person may help him feel more secure, but it isn't the same for the person with OCD. These actions for a person with OCD may complicate and distress or disrupt the everyday life. Now, let us talk about the symptoms of OCD. The 2 main symptoms of OCD are obsession and compulsion, and these are mentioned in the name of the disorder itself. A child with OCD may have difficulty in paying attention at school or completing the work. Let us talk some more about obsession. Obsession mainly means content of thought or content of obsessive thought. These thoughts can vary widely, but some of the thoughts may include: number 1, worries of germs, dirt, and illness. Number 2, fearing of harming yourself and others. Number 3, fearing of saying something obscene or offensive. Number 4, a need to align your positions orderly or in a symmetrical manner. And number 8, intrusive words or images. As I said, the content of obsessive thought may vary widely, but these are some of the most common thoughts by OCD person. These thoughts may come away and go, but may not go forever as hard as you may try. Now, let us talk about the examples of compulsive behavior in OCD. This behavior may include: number 1, washing your hands, your body, or your objects again and again. Number 2, organizing objects in a specific way. Number 3, repeating specific phrases. Number 4, touching something a set number of times. Number 5, seeking reassurance from others. Number 6, collecting certain objects or buying the same object again and again. Number 7, hiding objects that you can use to hurt yourself or others. And number 8, mentally going towards the thought that you haven't harmed anyone. So now a question arises: what causes OCD? OCD is idiopathic, which means there is no known cause. But having a family history of OCD may play a large role in your life. If you have a family member who has or have had OCD, then the chances of you having OCD may rise higher. Also, according to NIMH, that is National Institute of Mental Health, some irregular development or irregularities or impairment can also lead to OCD. And OCD has also been linked to serotonin. Some studies also show that serotonin also plays a major part in OCD. Talking about serotonin, it is a neurotransmitter that regulates your mood and sleep. There are many risk factors of OCD. Risk factor means the things that can lead or that can increase the chances of having OCD. These risk factors can include having a trauma, childhood abuse, CANS, and having a traumatic brain injury. Sometimes OCD can also occur along with other medical conditions. If you think you or any of your friends or family members have symptoms of OCD, then it's important for you to visit a doctor or take them to a doctor. Your doctor will take several sessions to confirm the diagnosis of OCD. Depending on the diagnosis, your doctor will talk with you to develop a treatment plan that works best for you. And that's all for today's video. If you have any questions or any suggestions, feel free to comment down below. Till then, stay safe and stay healthy.